Good morning, good day, good afternoon to all of my patients, wherever you are. Um, as you can see, I'm sitting at one of my desks in my office, um, just doing this video to try and let you all know that myself and my office staff, we are all here to help you navigate through these challenging times with COVID-19. As you may have heard, there's several pieces of advice that we agree with and recommend that you adhere to. You probably heard several times before on numerous sources on the TV, etc. The number one thing is social distancing. You need to practice that pretty much all the time. You need to stay home if you can, and if you can't and have to go out for whatever reason, you need to wear your masks properly, and you need to wear gloves if you have them available to you. And when you get back home from wherever you've been, you need to make sure you wash your hands thoroughly for at least 20 minutes with soap and water, and then use hand sanitizer after to sanitize your hands, and of course anything that you touched while you were out in your car, front door knobs, etc. And you need to do this on an ongoing, continuous basis. You should try and plan your outdoor visits when you're leaving the house as much as possible ahead of time to make sure you get as much done with as little time and exposure as you can. And of course, we know you are going to be home based for a little while. Does not mean you can't live healthy. You can still exercise, you can walk outdoors by yourself, you can cycle by yourself or with an immediate house partner. You can eat healthy and try and avoid too much in the way of comfort foods. But in spite of all this, I know you may from time to time need some medical advice, and that's why we're here for you. And I know you may be concerned and even to the point of being scared to come to our office if you had need to. And for those reasons, we have instituted several procedures, screening patients both on the telephone before they make an appointment and when they come to the office before they're let into the office waiting area, to screen them for any possible exposure or risks or symptoms of COVID-19, to make as much as possible the risk very low for you to come and be seen here. However, we do realize that there are those of you who are not able to or don't want to come to our office during these trying times and challenging times, and we understand that. And for that reason, we've instituted and implemented a very good computer-based televideo visit system that allows us to communicate with you on the telephone, on the televideo screen, just like you are physically here in the office, except we are not able to touch anybody. But it's very effective in allowing us to conduct medical office visits online, on video, with no risk at all to you or us as far as exposure. It's quite simple to do, and if you agree to that, we can have it set up for you and proceed with our office visits as though you were here, even though it's on the televideo. For your physical health, we made some recommendations, but I'm also going to make a couple of simple recommendations for your mental health. For those of you who are able to and can and probably know about already, there are several websites, computer programs that you can get involved with that allow you to visit with family and friends. There's Zoom, there's WebEx, there's a House Party. They allow you to communicate with relatively large groups of people remotely in all parts of the world, and it's very useful for maintaining contact with your family and friends that you may not have been able to do before when you were isolated. So all in all, once again, I just want to tell you that we are here for you. We will be available as usual in our office, same hours and after hours with on call. And we have as part of our group, we have a walking televideo that's available after hours on weekends when we're not around, if it's necessary. And I just want to remind you to keep calm and do your part. We're always here for you. Take care. Bye-bye.